Welcome to the good life. Health, fitness, nutrition, and vital living. Here's your host, Jesse Dillon.
Coast to coast and worldwide today, we provide you with a compendium of all the wonderful people on the planet: health, fitness, lifestyle, nutrition, dentistry, so that you don't have to go and search the internet on the thousands of websites trying to find them for yourself. I have to tell you a funny story. My son Justin, who's just about 22 years old, who's majoring in business at the University of British Columbia Sutter School of Business, he passed on the parental free offering to get braces when he was growing up. Josh and Joel took us up on the offer because we were paying for it, and we got them braces. And now Justin wants his mouth to look better, but he doesn't want braces. And Justin's a very sharp young man and does his homework. And he said, "Dad, the very best specialist in this area in orthodontics in the world does Invisalign." Of course, me being the idiot that I am, I said, "What's Invisalign?" And he said, "Well, Dr. Sam Dar is the very best in the world. I've done my homework, and he lives right here in British Columbia. Could I go see him?" And I said, "Well, you've missed the train. I offered to pay for your braces when you were growing up. Please, Dad." So anyway, I went into Dr. Sam Dar's office at the bequest of my son and had a chance to meet Sam. As it turns out, Dr. Sam Dar is the very best in the world at this practice. And we're going to talk about that today. Sam, welcome to The Good Life.
Hi, Jesse. Thank you for having me on the show.
It's my pleasure. You know, it's such an interesting world that we live in. Somebody wrote a book called RenGen, the Renaissance Generation, the cultural consumer. My son falls into that demographic. They do their own homework, and they come back because of the Internet. And I take it you are the world's best at this.
Absolutely. Thank you for that. Invisalign is a relatively new technique, so we've been going at it for a while now, 11 years or so. And we're trying to improve the product day by day.
Sam, tell me and our listeners a little bit about you. You've got a passion for what you do. Where did you develop this?
Absolutely. I graduated from dental school 15 years ago. Let me tell you just quickly, I grew up in Montreal, and my dentist, I used to be scared of the dentist. As a matter of fact, to this day, I'm still a bit scared of the dentist. So I developed my skills, I became a doctor, and then I decided later on that I enjoy orthodontics. So I went to the graduate school, and I started studying to become a specialist. And from there on, Invisalign was just on the cusp, and I realized with the technology and computer and everything that's going on in the world, that was going to be the future. So I dove in head first, and I enjoy it every day.
I want to talk about some of the fundamentals today between braces and Invisalign, because for the uninitiated, for those that haven't had sons like Justin who've gone and done their homework or haven't heard about it, my understanding, from what I'm led to believe, Sam, is that Invisalign is clear, see-through, non-invasive, and you actually could do Invisalign instead of braces for the same price.
Absolutely. You got it right on. Jesse, you've done your homework. Invisalign is basically is a series of clear aligners that patients wear in sequence, and they change them once every 2 weeks. And the concept is the exact same thing as braces. It moves and straightens the teeth one step at a time. So what braces do, Invisalign can do just the same, just using a different approach or a different technique. So it is clear, see-through. While you have them on, no one will know that you have them on, that you're straightening your teeth, unless you're standing up real close or light is shining a certain way. Otherwise, it's non-invasive, it's removable. You will have to wear it full-time. The only time that is taking off is when you're eating or drinking. And if you drink water, you can leave it in as well. So it does do the same thing. It straightens teeth. It fixes the bite. It aligns the teeth the same way.
What a huge advantage. And, you know, I can't believe that you said the only time you have to take it off is when you're eating. That's not a detractor in my opinion, because one certainly can't take their braces off when they're eating, and I bet that's the one time they would if they could.
That's exactly it. It's not easy to chew, obviously, your food with braces. There are some dietary restrictions with braces. You can't bite on, you can't chew gum, popcorn, what have you. Even carrot sticks and apples, which are usually healthy, you can't really chop with the teeth that have braces on. You have to cut them into bite pieces first. Whereas with Invisalign, you'll be able to take them off, chew your food normally, any diet, any food, and then put them back on afterwards, obviously after brushing your teeth.
Based on what I'm seeing and hearing, and on the due diligence that my very own son supplied me with, I mean, it's such a no-brainer. Why? And I I ask this question because I have to. Why would anybody get braces over Invisalign if it's the same cost but not nearly as invasive? I don't understand that.
That's a good question. Many of my colleagues in Canada and the United States are trying, and they're learning, and they're doing their best. It is a relatively new technique, and most of us were trained in graduate school to straighten teeth with braces. So when you have this new technology, you want to dive in head first. You want to learn the ins and outs. There is a learning curve in there, and I can tell you I paid my dues for that. Some of my colleagues are comfortable doing what they're doing, and most of my colleagues, and I'm proud to be a Canadian graduate, most of my colleagues are really wonderful orthodontists. It's just diving into this new technology is not as easy for them sometimes, so they just shy away and stick to what they feel comfortable with.
Dr. Sam Dar is my guest today. We're talking about Invisalign, this remarkable, relatively new technology that Sam has become the world's top specialist in, recognized as such by Invisalign, the company. FreshSmileOrtho.com is the website. Dr. Sam, who is a candidate for Invisalign? Age groups, men, women, etc.?
It starts as early as 12 years old until my oldest patient is 82 years old. So there is no age limitation per se. It's the same age as braces. If people still have some baby teeth, we may wait a bit. But with the new teen Invisalign, now we can treat kids that have baby teeth as well. So there is no real age limitation or sex limitation at all. It applies the same concept as braces.
Would that not be a huge benefit, especially, perhaps not especially, but to young children? I just go back to my own kids. When Josh and Joel were getting their braces, I'm thinking, my goodness, if we were aware and as educated on Invisalign today, or back then as I am today, there's no question what we would have done for our guys. My opinion, it would have been so much less strenuous and invasive on them, and the constant, constant times they had to go in and get the braces checked and get them fixed. I mean, and there's a fair amount of pain associated with that as well.
There is some discomfort, and not to mention the fact that you have to, it's a lot harder to keep the braces clean, obviously, because it does retain food, plaque, and bacteria as well, and this is always an uphill battle with children to keep their braces clean because they have to brush their teeth a lot more frequently. With Invisalign, it's the same frequency. We still urge them. They are more motivated, and it's a lot easier to clean the teeth with Invisalign simply because you have them removed when you brush your teeth. So it does make a difference from a health point of view as well. Aesthetically, we don't have to, it's not a punishment. I don't want my patients to feel that it's a punishment they have to pay for having straight teeth. Now you can have straight teeth and make the process a lot less painless. And they can gain confidence from day one, basically.
I'm glad you brought that up. You know, we recently released a book called The Good Life with Jesse Dillon, Redefining Your Health with the Greatest Visionaries of Our Time. Dr. Michael Roizen, who is chairman of the Cleveland Clinic, who along with his writing partner and Oprah's personal doctor, Dr. Mehmet Oz, they have both co-authored 6 New York Times bestselling books. Mike is chair of the Cleveland Clinic, and frankly, I think he's the best doctor on the planet. And I asked him to co-contribute a chapter in my book on health, and I asked him for his top 10 tips. And while I was interviewing him for the book, he said, floss your teeth. And I said, what? I said, Mike, you're not a dentist. And he said, of course I'm not. But if you don't floss your teeth, Jesse, what we've learned and what we've studied here at the Cleveland Clinic is the tremendous amount of bacteria that's released in the system that not only causes cardiovascular issues, but diabetes, etc. And, of course, that can start young.
Absolutely, and the research is actually overwhelming in the last 15 years, and it's all coming from the medical field, mostly as opposed to the dental field. And a clear link has been established between gum disease and basically cardiovascular disease, premature birth, diabetes as well. So they do exacerbate the problem. They may even trigger it. Research is still ongoing. So when you have crooked teeth and overlapping teeth, there is no way for the layperson to clean their teeth very well and reach all the bacteria that is hiding in there. So having straight teeth obviously will allow the patient to clean their teeth a lot better and prevent basically the flow of the bacteria into the bloodstream through the inflamed gums.
Also, because you're not wearing braces and you have the opportunity to take off the Invisalign liners, you can get in there and floss and take care of your teeth. It's just, to me, it's a no-brainer. It's amazing. FreshSmileOrtho.com. Dr. Sam Dar, the #1 specialist on this planet, and he's in Vancouver with a couple of locations, West Vancouver and one downtown. We are giving father and father's families the gift of the good life this Father's Day, which is upcoming. Dr. Dar, could we procure you into giving away some complimentary consultations?
Absolutely, with pleasure. For Father's Day, can't say no to that.
And so how did they get a hold of you, Dr. Sam?
They can contact me at either office. Both offices are open Monday to Thursday. So either by email or a phone number at 604-913-1555 is my West Vancouver office. And my downtown number is 604-662-3290. Or just go on my website and send in a request at freshsmileortho.com.
Dr. Sam Dar, certified specialist in orthodontics, not just any specialist, the best in the world at this procedure. freshsmileortho.com. Dr. Sam, thank you so much for your time.
Thank you, Jesse. Nice talking to you.
This is Jesse Dillon. You are coast to coast and worldwide today, listening to The Good Life.